So let's take a look at the sports medicine training. As a sports medicine trainee, you typically are involved in learning from multiple specialties. So whether it's orthopedics, rheumatology, cardiology, you'll even get training from allied health professionals such as physiotherapists, podiatrists, dietitians. So we take learning from lots of different specialists, and we sort of consolidate it into our curriculum. There's also an element of musculoskeletal ultrasound, and this is something that we use a lot in our clinical practice. And then, depending on where in the world or you may be training, you may have the benefit of sports clinics. So in Singapore, we have sports clinics in the government hospitals. So in Kutek Prat, in Tan Tock Seng, Changi General Hospital, NUH, they all have sports clinics, and in some places, you may be able to work with sports teams to gain exposure in the team environment. The training program covers a wide variety of different things. Of course, as I mentioned before, musculoskeletal medicine is very key to sports medicine. We do deal with a lot of musculoskeletal injuries, and I'll come on to some of those later on in the types of injuries and conditions that we may see. But as I mentioned before, exercise medicine is very important as well. So not just looking at things from an exercise physiology perspective, but also exercise prescription, injury management in terms of prevention, research, and rehabilitation. And then there's the whole general medicine and um, general practice aspect of it, because different sports medicine consultants may have different facets to what their work. So one of my good friends and colleagues, he is the national team doctor for the England women's football team. So as you know, recently they won the European championship, and so he's been involved with them for the last 15 years, seeing them grow from junior athletes to seniors, and he has to look after them in a holistic way, not just from a musculoskeletal injury perspective, but everything from coughs and colds to dysmenorrhea to diarrhea and vomiting, and even travel and medicine as well. So, you know, um, there's many different facets to what we have to do. To go with that, as a consequence, the syllabus is very diverse. And as you can see, and it's a little bit scary when you first look at it, there's a whole bunch of different things that you have to cover. So you can see, there's the general medical skills that you have here in terms of safe prescribing, history taking, and so on. Then it's more specific things about exercise physiology, anatomy, and nutrition, and the effects of exercise on health. Then there's a bit more about musculoskeletal medicine. And then we flip on to other things such as injury management, team medicine, event medicine, and dealing with emergencies. So, really, the sports medicine syllabus takes elements from lots and lots of different medical specialties, whether it's emergency medicine, orthopedics, radiology. And so it really consolidates stuff that's related to exercise and sports and brings different facets together. So as you can see, it's a very varied specialty. Um, you do require a whole variety of different skill sets. But given that, it also enables lots of different opportunities in terms of career pathway and looking at what you want to do. You tend to rotate through a whole variety of different specialties, as I mentioned before, and it's really you're really a kind of steward, I guess, of the whole multidisciplinary um, uh, team, and you are very involved with allied health as well as other medical specialties. But it does mean that it's a very varied and interesting line of work to be involved in.